So we are making our way right along. And at this time, I would like to invite Michael Gaines, who is the corrections coordinator at the Illinois Department of Public Health. And he is going to help me congratulate this year's Community Reentry Champion Award recipients. Now, at each reentry conference, we present the Community Reentry Champion Award, which Michael is going to tell you a little bit more about. So every year we do this, and we are super excited about this year's recipients. So please welcome Michael Gaines.
Good afternoon, everyone. I hope that you are enjoying the conference thus far. My name is Michael Gaines, and I am the Corrections Coordinator with the Illinois Department of Public Health in the HIV/AIDS section. At each reentry conference, we award the Community Reentry Champion Award. This award is given to deserving individuals, agencies, organizations that simplifies continued service and dedication to the reentry community. I was the first recipient of this award, and I know personally the gratitude I felt after receiving this award. This year, we would like to recognize 3 very special individuals. Each of these individuals have experienced the justice system in some way, but has not stopped them from being leaders in the field of reentry and continue to help others experience some of the same success that they have had. At this time, I would like to announce this year's recipients. The first recipient is William Johnson. William Johnson was incarcerated at Graham Prison, but while he was in Graham Prison, he actually worked with the Illinois Department of Public Health as a peer educator. He actually helped individuals get tested, know about HIV, know about hepatitis C, but also combated the opioid crisis, dealing with Narcan and information. When William was released from Graham Prison, he continued to work with Fifth Street Renaissance, working with the Summits of Hope, continued to help those get linked to care and services, and continue to be a shining light in Central Illinois community. William, we appreciate the work over the years, and congratulations on receiving this award. The next award recipient, Marlon Chamberlain. Marlon is and has been an advocate for people directly impacted by the justice system. He has worked with Safer Foundation, Heartland Alliance, and Force Initiative. Marlon continues to serve the community through his participation as a founding member of the Restoring Rights Opportunities Coalition of Illinois, chair of the Living Free Decarceration Advisory Committee, alumni of the Just Leadership USA. Marlon also serves as a reentry advisor at the Public Health Institute Metropolitan of Chicago. Marlon, we appreciate your work over the years, and congratulations on receiving this award. Last but certainly not least, the final award recipient, Willette Benford. Willette is a social justice advocate, sought after speaker, minister, and returning citizen. She spent over 2 decades inside, punished for a survival crime. Willette is the first woman in the state of Illinois to benefit from the amendment, the Illinois Criminal Code, that made domestic violence a serious factor. This resulted in her being granted an immediate release from the Illinois Department of Corrections. Willette is involved in the community with the decarceration organizer for Live Free Chicago. She is a board chairwoman for the Full Free campaign to end permanent punishment and serve in many community reentry organizations. Willette serves as a reentry advisor at Public Health Institute Metropolitan of Chicago. Willette, we appreciate your work over the years, and congratulations on receiving this award. Thank you to each of you for your work over the years. These awards are well deserved. Thank you, Public Health Institute Metropolitan of Chicago, for allowing me to present these awards. Rashonda, back to you.
Thank you, Michael, and congratulations to this year's recipients, William Johnson, Marlon Chamberlain, and Willette Benford. Each of you are so deserving, and it is an honor to be able to recognize each of you. I have personally worked with each and every single one of you and know that you all are doing amazing work in the field. So again, congratulations. At this time, I would like to thank each and every one of you for your participation in today's conference. Your comments, questions, and curiosity really helped to fuel today's event. If you can't tell, I'm so excited. I am so excited that we made it to this point. So while our brains are likely in overdrive, today has been so special. Some of us were enlightened, challenged, but I hope we were mostly changed for the better. And as we say often, sometimes this work is not easy, but it can be so rewarding. Our hope is that you have some needed information and tools that you can take back to your spheres of influence. So what next? Here are some key points we heard from some of today's speakers. We heard that it is important to create culturally appropriate and accessible community services to address health disparities. We also learned that it's important to have preventative health care for justice involved individuals. And then another thing we learned is we need to amplify the voices of those with lived experience, not just in reentry programming, but also in development, also in creating spaces such as this. When we saw performing artists, we need to amplify those voices. We also learned the value of having tools such as resource guides and networks of support for formerly incarcerated individuals. We also learned that it is very important to have holistic reentry and create programming that is adaptive to the individuals that we are serving. Everybody is different. We also learned a host of other key points, tips, and tools. And shameless plug, if you want to stay up to date, check out our Twitter feed because we've been tweeting all day some of these action and PowerPoints. We want to say thank you to every presenter, panelist, speaker, moderator, and volunteer. This conference would not have been possible without each of you. I would also like to acknowledge a few key partners and our sponsors who made today the amazing day that it was. First up is AV Chicago, who was our production team and our website designer, and they are behind the scenes killing it. So we want to say thank you to AV Chicago. We also want to thank this year's conference sponsors, which is HIV Care Connect, the Illinois Public Health Association, and ViVE Healthcare. Thank you so much. And to learn more about each of the great work that these organizations are doing, please visit the supporters tab on the conference website and click their logos, and that's going to redirect you to their respective websites so that you can learn more. We also want to shout out the Education Justice Project, who printed and sent over 200 reentry guides to our conference registrants. So if you register for this conference, you got one of these awesome and amazing reentry guides. So if you did not receive one, but you would like to, we encourage you to check their website out at www.educationjustice.net to order your own guide. And we would also like to thank the Illinois Department of Public Health, who has been a longtime supporter and partner of this work. Thank you, thank you, thank you so much. And then there is absolutely no I in team. So I would also like to send a huge, great big shout out to the PHIMC team for their assistance today, which would include Cynthia Lee, who is our project associate, Ray Phillips, who's our communications director, and Katie Morin, who is our data strategist, and to each one of our staff volunteers that assisted in the breakout rooms or at anywhere throughout the day. Thank you. And we also want to thank our leadership team at PHIMC for giving us the support that we need to put on today's event. So just a few final housekeeping items before we let you all go today. And we're going to let you all go just a little bit early. But on your screen, you should be seeing a QR code. And the really cool thing about this is you are able to use your phone to scan this QR code to pull up the overall conference evaluation. You can also click the link that our staff is going to be sharing in the chat if you like to complete it on your computer. So you can use your phone or your computer. We truly do use these evaluation forms to continue making these conferences experiences worthwhile and ones that you are going to enjoy. This year, those who complete the evaluation will receive a gift card post-conference as our way of saying thank you. In the great words of Oprah Winfrey, you get a gift card, you get a gift card. Everybody's going to get a gift card if you complete the conference survey. So please make sure that you do that. Do it right now before you forget, so that we can make sure that we get all of your amazing responses. Now, when you are completing it, be sure to provide the same email address you use to register. Make sure that you put that on your evaluation form as well. And please note that the survey will close on Friday, March 11th. So make sure that you get your responses in as soon as possible. For those of you who register for continuing education units, please note that you will be awarded CEs via email to the email address indicated on your registration form in the next 4 to 6 weeks. You must also complete the appropriate evaluation form from both your breakout rooms that you attended and the overall conference evaluation. Immediately following this portion, we will be opening our networking room for 30 minutes. So if you have any last minute questions, or you want to connect with someone, or you just want to explode because of all the amazing information that you got today, you are welcome to do that. And we're going to close that room promptly at 4:30. So join us over there for the after party for the conference. So we hope that you'll join PHIMC for future community reentry events. You can keep up with PHIMC by joining our newsletter or following us on social media at PHIMC News. As I stated earlier, if you heard something today that was profound, insightful, or new to you, please share it on social media using the hashtag Illinois Reentry. Our team will make sure that we retweet it, we regram it, or share your posts. So we hope that you'll consider attending future conferences, workshops, and learning opportunities so that we can further explore ways for impactful partnership. PHIMC is committed to expanding capacity of healthcare and public health systems to promote health equity and expand access to care. Partners like you make this possible. So with that being said, this officially concludes our 2022 Illinois Reentry Conference. We hope that you will be well, be safe, and have a wonderful evening. Thank you for joining us.